Katrina Kane, and welcome to Ties Online Tutoring Academy. I am going into the CNA study guide material, just a read through. If you need someone just to read through and study with, I'm your girl, and I am at the section that's dealing with hair care. We already went through two previous videos, and we're at the section that's covering activities for daily living. So we're looking at those skill sets, and we're just diving right in. We're trying to make these video relatively short, 15 if so, go over a little bit thereabout. So I'm just gonna dive right in, so the information can be beneficial. So hair care, starting with brushing hair. Brushing hair increases blood flow to the scalp and keeps hair from becoming matted. Provide hair care when it is needed or requested. Some general guidelines for brushing hair are given below. 1. Wear gloves if there are scalp sores or a large amount of matting or dirt. Next, be sure there are no broken or sharp bristles or teeth in the comb or the brush. Third, place a towel behind the patient's head or on their shoulder to catch the falling hair. Next, comb curly or coarse hair starting from the nape and move upward, fluffing hair. Afterward, next we comb straight hair from the top of the head and smooth hair downward. For hair tangles, we hold the hair with one hand above the tangle and comb out the tangle. Avoid pulling on the patient's scalp. Now we had shampooing. Shampooing hair may be done daily or few times a month. Many long-term care residents have their hair washed on their bath day or in the hair salon. The tub or shower typically has a handheld spray that facilitates shampooing. For bedbound patients, some facility has an inflatable basin to wash their hair in bed. When shampooing, focusing on patient safety by keeping water and soap out of the patient's eyes. A washcloth may be used to cover their eyes. Always make sure not to scrape or damage the scalp when massaging the shampoo in the hair. Remove items that may be damaging by water, such as hearing aids, before starting. Safety is an important focus when shaving patients. Safety razors may be used for most patients. However, patients at high risk for bleeding or skin injury, example those with diabetes or bleeding disorders, may require the use of an electric razor. If bleeding occurs, apply pressure and report per your facility's policies. Always moisten the earrings to be shaved before starting, and use shaving cream. Hold the skin taut and shave in the direction of the hair growth, except when shaving the legs or using a rotary shaver. Helpful tips: always report any sores, hair loss, or the presence of nits or lice. Okay, on to our next review question. It says, a nurse aide is brushing a patient's hair and noticed sores on the scalp. The nurse aide should A. Offer to shampoo the client's hair, tell the client to report the sores to their doctor, C. Clean and bandage the sore, D. Report the sores to the nurse. And the answer is D. When the nurse aide notices any changes in the skin condition, includes sore on the scalp, they should notify the nurse. We're moving on. We're on now to nail and foot care. So trimming of nails. Trimming nails prevents infections, odors, torn nails, and lacerations. For patients with conditions that impede healing, such as diabetes, a small injury in their foot can lead to serious complications. For this reason, most facilities do not allow nurse aid to trim nails. If the nurse aid is asked to trim nails, they should use caution if the patient has diabetes, circulatory problems, or an ingrown nail, or are on medications that cause bleeding. General guidelines for nail trimming are given below. 1. Soak nails before trimming, so 5 to 10 minutes of fingernail for fingernails, or 15 to 20 minutes for toenails. So soak the nails. So that's 5 to 10 minutes for fingernails, or 15 to 20 for toenails. 2. Clean under the nails with an orange stick. Clean the orange stick with a towel after each use. 3. Gently push back patient's cuticles with the orange stick. 4. Clip nails straight across and file any roughness with a emery board. Next, apply lotion under the hands or feet. Apply lotion after the hands or feet are clean and dry. And next, report to the nurse any injury or signs of infection, such as blisters or ingrown nails. Helpful tips. Never leave water or lotion between a patient's toes. Skill evaluations. Providing foot care on one foot. 1. Check what is the temperature for safety and comfort. 2. Lay down protective barriers and place basins where patient can put their foot in it. So lay down protective barriers and place the basin where the patient can put their feet in it. 3. Put on gloves. 4. Place patient's foot in the water. 5. Lift foot and wash with soapy cloth. 6. Rinse the feet with water. 7. Dry, ensuring areas between the toes are dry. And 8. Apply lotion to the foot, all areas except between the toes. 9. Clean, store, dispose of supplies using clean technique. Our question review is this. A nurse aide is trimming a patient's fingernails and cuts too deep, causing the patient to bleed. The nurse aide should clean and bandage the wound. B. Leave the wound alone and get the nurse. C. Apply pressure to the wound and alert the nurse. D. Place the patient's hand back into the water basin until the bleeding stops. And the answer is C. The nurse aide should apply pressure to the wound to prevent further bleeding and immediately notify the nurse. Okay, now we're going into nutrition and hydration. Nutrition and hydration. So nutrition basics. Food provides nutrition. The molecules that provide energy and the chemical building blocks the body needs to function. There are 5 main groups of nutrition. We have carbohydrates, fats, proteins, vitamins, and minerals. So carbohydrates are sugars that provide easily accessible energy for cells. Fats are molecules that store energy for later use. Protein performs a range of functions in the body, include providing structural support in cells and tissues. Vitamins are molecules the body uses in small amounts to function but cannot make it on its own. Minerals are elements such as calcium that the body requires to function. People must eat a balance of different foods to meet their nutritional needs. The United States Department of Agriculture has created dietary guidelines called My Plate to help people eat appropriate amounts of fruits, vegetables, grains, proteins, and dietary foods. Grains are foods made from wheat, rice, and other cereal crops. They are high in carbohydrates. Fruits. Fruits are seed-bearing parts of plants. They provide essential vitamins and minerals and are low fat. However, they may contain high amount of sugar. Vegetables are the leaves, the stalks, and roots of plants. They provide essential vitamins and minerals and are usually low in fat and sugar. Dairy. Dairy products are made from milk. They contain calcium and vitamin D, which are essential for bone health. And protein. Protein comes from animal source such as beef or plant source such as tofu. Special diet. Before we go to special, look at some helpful tips. It says calories are a measure of the energy in the food. Fats are the most calorie dense nutrient, which is 9 calories per gram. Okay, so let's go right in. Okay, special diets. Special diets are defined by their texture or the type of food they contain. Clients may require special diets to manage allergies, their physical limitations, the metabolic disorder, or medical interactions. They may also follow special diets for cultural or religious reasons. So we have a diabetic diet, which is strictly regulated carbohydrate consumption. We have a low sodium diet, which is low in salt, and we have a cardiac diet, which is restricted fat and salt. Dysphagia is difficulty swallowing. Patients with dysphagia may require a special diet, example, mechanically soft, to reduce the risk of choking. Okay, we continue with the other list of diet. There's so many. We have a clear fluid diet, which is liquid only, including water, clear broth, and popsicle. And we have a full liquid diet, which is food that become a liquid at body temperature, such as ice cream or cooked cereal. We have mechanical soft diet, which are semi-solid, easily digestible food like scrambled eggs and shredded meat. So that's mechanical soft diet. We have residue-free diet, and that's low in indigestible food like fiber and seed. That's residue-free diet, low in indigestible food like fiber and seed. We have a high fiber diet, and that's high in fiber such as fruits and grain. We have a bland diet. That's low fiber foods without strong spices, such as white toast or cottage cheese. We have a high calorie diet, which intake of 3,000 or 4,000 calories a day. We have a limited calorie diet, which is restricted calories to promote weight loss. We have a vegetarian diet, which is no meat. We have a vegan diet, which is no meat, no dairy, or any animal product. We have a kosher diet, which is food prepared according to Jewish dietary laws. And we have a halal diet, which is food prepared according to the Islamic dietary laws. Okay, on to our next review question. What type of diet might be ordered to help a patient with constipation? Constipation. What type of diet may be ordered to help a patient with constipation? A, high fiber. B, clear liquid. C, vegetarian. D, low sodium. So constipation. The answer is diets that are high in fiber can help relieve constipation. So the answer is A, high fiber. High fiber helps with constipation. All right. I'm gonna push this video a little bit more because it's probably one more skill set. I don't want to be long, but just a little bit more. So next we're looking at hydration basics. Hydration is the balance of fluid in the body. Adequate fluid intake prevents conditions related to dehydration, including constipation and urinary tract infection, dizziness, and heart problems. Fluid balance is often assessed by measuring a client's intake and outtake, INO. Intake is all the fluid the client consumes. Out, so that's input. I'm saying intake. Input is all the fluid the clients consume, and output is all the fluid excreted from the body. Intake and output is measured in milliliters. Common conversion amount for intake includes 1 teaspoon is 5 milliliters, 1 tablespoon is 15 milliliters, 1 ounce is 30 milliliters, 1 cup is 240 milliliters, and 1 pint is 500 milliliters. So 1 teaspoon is 5 milliliters, 1 tablespoon is 15 milliliters, 1 ounce is 30 milliliters, 1 cup is 240 milliliters, and 1 pint is 500 milliliters. Some patients have special orders affecting their intake of fluids. So NPO is Latin for nil per os and means nothing by mouth. Patient on NPO cannot eat or drink. NPO. So encourage fluid means that something to drink should be offered as often as possible to keep within reach. Patients listed as restricted fluid are allowed a limited amount of fluid determined by the doctor. I'm just going to repeat that paragraph because I think it's very important. It says some patients have some special orders affecting their intake of fluid. So the NPO is Latin for nil per os, which means nothing by the mouth. So patients on the NPO cannot eat or drink. And then you will have one called encourage fluid. And this means that something to drink should be offered as often as possible and be kept within reach. So we are encouraged fluids. That's called encourage fluids. So it should be offered as often as possible and kept within reach. And then the patients that are listed as on the restricted fluid are allowed a limited amount of fluid determined by the doctor. So the last assessment question for this section before we move on to the next video, it says a patient who is NPO asks the nurse aide for a lunch tray. The nurse aide should tell the patient they cannot eat any food and alert the nurse to the patient's request. B. Offer the patient a glass of water instead. C. Leave a lunch tray but tell the patient to talk to their nurse before eating. Or D. Offer a snack and tell the patient they cannot tell the nurse they ate. And the answer is A is correct. The patients who are on NPO should not eat or drink. The nurse aide should tell the patient they cannot give them a lunch tray and alert the nurse so she can talk with the patient. Thanks for watching, and until the next video as we continue these series. Thank you.